AMH test. AMH test means anti-Mullerian hormone test. Now, this measures the level of anti-Mullerian hormone using blood sample to assess a woman's ovarian reserve. That is to know the number of eggs that is left in a woman's ovary. This can be done when a woman wants to go for an IVF, okay, to know the amount of egg to retrieve. It will also help to know if a woman is approaching menopause. This anti-Mullerian hormone will also help to diagnose polycystic ovarian syndrome. However, if you have gone for AMH test and you have been told that the number of eggs left in your ovaries are low, you shouldn't fidget. You can still get pregnant as a woman with that. But all you have to do is to eat things, do things that can boost the quality of those eggs. Anti-Mullerian hormone test does not show how quality those eggs are. It will only show the number of those eggs left in your ovary. Ways to know you're pregnant just before you miss your period. Number one is abdominal cramps, abdominal pain. These cramps is usually mild, not severe. The kind of cramps you have when you are about to menstruate, most men may think it is their menses, not knowing it's pregnancy. Now, this happens within 6 to 7 days when the fertilized egg is traveling from the fallopian tube to the woman's womb. Number two is implantation bleed or implantation spotting. Not all women also experiences implantation bleed or implantation spotting. Okay, this is when the fertilized egg is trying to attach itself to the lining of the woman's womb. A woman will notice slight spotting, kind of pink-like bleeding or brownish discharge. It is not the same way your menstrual flow happens. Okay. Number three is a slight increase in your basal body temperature. You notice that your basal body temperature has increased. You can begin to feel warmth. That is another way. Number four is morning sickness. Your nausea, or sometimes you can vomit and you begin to feel weak, like you begin to feel like you're sick, a kind of malaria kind of signs and symptoms. Okay, some people may also begin to dislike some certain food, or they will begin to crave for some certain food. Okay, so with these 4 ways can give you a guide just before you finally realize a missed period that you are pregnant. Okay, bye. Genders, if you love eating instant noodles, please come closer. This video is for you. A study carried out by a particular university discovered that eating instant noodles 2 or more times a week could increase your risk of having metabolic syndrome. Metabolic syndrome is a condition that is linked with heart diseases, diabetes, and even stroke. Now, here is the drama. This research was only discovered on women. It shows that women that consume instant noodles twice or more times a week have higher risk of having metabolic syndrome. But why women? Why not both genders? Well, some researchers believe this could be due to hormonal differences and a particular chemical called bisphenol A. Bisphenol A is a synthetic chemical that is used in making food containers like instant noodles. And this bisphenol A has the ability to disrupt the estrogen hormone. However, instant noodles are high in sodium, which can increase your risk of hypertension and other heart diseases. It also contains unhealthy fats and has low nutritional value, low fiber, low vitamins, low minerals, and low protein. This means both genders, men and women, you should also be cautious of how you consume Indomie, not just women alone this time. And does this mean that we should not eat instant noodles again? Well, not really. Eating in moderation is the key. And when it comes to the spices used in preparing this instant noodle, noodles. Let's say, for example, you are preparing 2 cups or 2 sachets of instant noodles. Instead of using both spices, you can just use one of the spices to prepare both instant noodles. And while preparing instant noodles, you can remove the first water, then place it back on a heat and continue your cooking. Like I said, eating in moderation is the key. And you can also pair it with other nutritious food to reduce its risks. I hope this was helpful. Bye. When some people check their blood pressure and they see figures like this on the monitor of their blood pressure, they often get confused on what exactly those numbers means or where exactly it is coming from. Let me explain. Now, those numbers are indicators of what your blood pressure is supposed to be. And where exactly is it coming from? They are coming from your heart. Now, as the heart squeezes, that is, it does this boom, boom, that is the pumping of the blood to the vessels of the body. Now, as it does gbogon, that is squeezing, that is the upper number. And when it relaxes, that is the lower number. What number of blood pressure will you see that will tell you as a person that you are normal is 120/80? Now, for some person, it can be slightly higher than this. When it is 140/90, it means that person is hypertensive. The person has hypertension. And when it is lower than 140/90, we call it pre-hypertension. That means that person is about to have hypertension. See figure like this on the monitor of what we call hypertension urgency. You shouldn't joke with figure like this. If this person with this kind of blood pressure is not careful, if the intervention is not taken immediately, this person can die from it. Organs can be damaged, brain can be damaged, it can damage so many. Why is it important to check your blood pressure as a human being? It is important because sometimes blood pressure does not always present with symptoms. Now, like they say, it is a silent killer. Before it will even give any symptoms, it has started damaging organs in your body. The blood pressure can cause stroke. It can make you to have kidney problems. It can even cause you to begin to bleed from the nose. It is important to check your blood pressure to prevent complications. Some persons can even slump and die from there. It is when some of them slump and they are being rushed to the hospital. There in the hospital, they check, then they discover they are hypertensive. Please always check your blood pressure. It is very, very important.